if you have questions, please don't be shy, because I'm sure other people have the exact same question you do. The authorization form is actually not attached. Val has those in the back, so if you do decide that you want to let Valerie or the facility representative help make the decisions and go through that process, Val has those in the back. So what you have in front of you is actually a sample letter of what people are going to start receiving, and this is an enrollment letter. Okay, this is a welcome letter saying, hey, you are going to be part of this, what we call dually eligible program, and these are your options. Okay, has anybody gotten these letters? Okay, a couple. All right, great. Any questions right off the bat before I get into it a little bit, or?
Are we obligated to these?
Yep.
You are, yes. For the Medicaid portion of the services you receive. So just to give you a little bit of background on what the whole theory of this is for, this is a pilot program. This is a demonstration, and it's going to last for 3 years.
Is this by Mr. Obama's direction?
It is actually by Mr. Kasich's direction. He had enrolled or elected Ohio to be part of this demonstration program. If the demonstration lasts for 3 years, and if it's successful, then it will continue long term. So the very basic idea of this program is to have all of your services coordinated by one case manager. And so these three options that we have, here in Geauga County, each one of those carriers will have a case manager for specifically each enrollee. And that...
Well, not to interrupt you, but I was just hoping that you would fill us in on which choice will give us the best coverage for here.
We're going to talk about that, yeah,
We'd like
for this
to know.
particular facility,
Yeah.
and then also externally too.
Yeah.
We'll definitely get to that. So the idea is that this case manager will help manage all of your care services. Because as you probably know right now, you may have Medicare as well as Medicaid. And each provider that you go to, whether it's a pharmacy, a physician, therapy services, hospital, skilled nursing facility, some of it's billed to Medicare, some of it's billed to Medicaid. And so the demonstration says it's too broken up. You know, they want to coordinate all of your benefits into one option in which a case manager can help better manage all of your healthcare needs. That's the goal or the objective of this program. So it's giving you three options, right?
Or control.
That could be true, yes. Each of you currently have Medicaid and Medicare, okay? And so what's going to happen is one of two things. This HMO, this insurance carrier, will manage both of those types of payers. So you no longer will have traditional Medicare or traditional Medicaid. You'll have this one carrier, okay? However, you do have another option, okay? The second option is that you can opt out of the Medicare portion of this program and retain your traditional Medicare benefits. Okay? In other words, your Medicaid benefits would be managed by this insurance company, and you would still have your traditional Medicare benefits as you do today. Okay? So they are still giving you that option. And I think it's a really important option to consider personally. Obviously, you have to make the best choice for yourself. But as you may or may not know, this project is only going to be activated or demonstrated in certain counties. Okay? So it's not every county in Ohio that's going to be in this program. It's only certain counties. So again, Medicare is a federal program that will cover wherever you went in Ohio, or actually within the U.S., Medicare would cover whatever services you needed. That's why that might be a good option for you, okay? Because this demonstration are only in certain sections of Ohio, certain counties, if you choose United Healthcare, let's say, and you receive services in Licking County, I'm just trying to pull one out of the air here, but let's say you receive services in a different county that is not a participation in this program, that county may not accept that carrier. Which, and maintaining your traditional Medicare benefits would be an option that would give you the most coverage if you did have specialists or were going to a different county.
Is Cuyahoga in front of it?
Yes, it is. Cuyahoga, Lorraine, Lake, Geauga, Medina are all in the same rollout. So if you have maybe specialists at the Cleveland Clinic or Hillcrest Hospital or something like that, those counties are actually a part of this demonstration. How to pick which one is best for you? Again, you can opt to stay out of the Medicare, portion of it. Your Medicaid benefits do have to go through one of these three choices.
I have benefits for myself, but my wife is a patient here.
Okay.
She is a Medicaid patient.
Yes.
But I am covered under Medicare.
Okay.
I am somewhat unusual in that I was a member of the professional staff at the Cleveland Clinic.
Okay.
So that I get health care for life and from the Cleveland Clinic.
Okay.
So I don't really know how the distribution of whatever it's going to be. See, Medicare or Medicaid covers first.
Medicare covers first.
And then our health care coverage at the Cleveland Clinic is secondary.
Okay. And if you have very specific questions about your personal type of plan that you may have, I'll be more than happy to talk about that with you individually. But there are you have to be what's called dually eligible, which means you have traditional Medicare, all Medicare benefits, and traditional Medicaid benefits. So I don't know every plan, but I do happen to know off the top of my head that certain pensioners' plans, okay, like Anthem happens to be a pensioner's plan that I know for sure. If you are covered, let's say, by the pensioner's plan, you are actually not considered dually eligible, and therefore do not have to participate in the program. So we'll definitely have to take a look at what type of individual plan you may have to see if it qualifies for as a pensioner's plan or something to that nature.
What if you're just on Medicaid?
If you're just on Medicaid, and you don't have any Medicare benefits or other benefits, then nothing's going to change.
Except workers' comp.
That's okay, then nothing will change for you. You'll still continue to have your regular Medicaid benefits as long as you're in this, like a nursing home or a hospital setting. Now, if you should go back out to the community.
That's where I'm at.
You are in the community? Okay. Medicaid offers many different types of Medicaid programs. They can't make it easy. I mean, it can't just be one program and everybody's on it. So depending on the type of program that you're on.
I'm a disability of the Medicaid.
Okay.
I haven't gotten any letters about choosing.
If you don't have Medicare, you will not have to choose. This is only for, this demonstration is only for people who have traditional Medicare benefits as well as Medicaid benefits.
Okay.
So if you have just straight Medicare and no Medicaid, you're not part of the program. And vice versa. If you have just straight Medicaid and no Medicare, you don't have to opt into this program.
How would that be affected? Since I just have Medicare and my wife has Medicaid.
Since you would not have to be eligible, you would not be eligible for that program because you wouldn't have that Medicaid coverage. But your spouse would be part of that program. you guys could still be, your spouse could be covered and part of that program, but you don't necessarily have to be, because you're not what they call dually eligible. No, it's easy. No, it's not easy. Even for somebody who works on it every day, I'm still finding out things that are surprising to me or new to me. What sort of question?
It's saying that Medicaid or that program we want everyone to come to, what if they don't authorize your doctors or your outfit? You have to switch?
Not during the demonstration. Let's talk about that a little bit.
Always a street.
I know. They just can't make it like a one set of rules. There's always an if. Remember, this is a demonstration, a 3-year demonstration. And because it's only in certain counties, part of that demonstration recognizes that not every physician or therapist or pharmacy will actually participate in it or get contracts. So that's okay though, there is a caveat, there is a little saying here. During this demonstration, the carrier that you choose will honor out-of-network carrier physicians or therapists. You do have to get it authorized. You still have to get the services authorized.
Is it 80/20 or full coverage?
No, actually, it's going to work similar to Medicaid in the fact that the only copay that an individual would have would be based on their income. Everybody here might have a patient liability, like you owe the nursing home $100 or whatever. You're still going to have that. Like a spend down, exactly. You still would have your spend down, and these services or copay would count towards that spend down. Now, what they're telling us right now, of course, this is brand new, so I will make a little comment that anything is subject to change by the time it actually comes full force. But what the program is designed to do is to not charge those copays in excess of what the spend down is. Questions? Okay. So which plan is going to be best for you? If you're here at this facility, we will have a contract with all 3 plans. Okay? So regardless of which plan you choose, this facility is contracted with all 3 and will be, and your services would basically be unchanged. It only changes who we bill for the services. Instead of billing Medicaid, I'm going to bill Molina or United Healthcare. Okay. However, you don't want to assume that just because the nursing home has a contract, that all of your doctors have contracts. So the best advice I can give you is to contact the services you use most often. Your specialist, your primary care physician, hospice, pharmacy, whatever services you might receive in the community, and find out if they are going to contract with one or all of them, and you might want to go with the one that is your doctor is contracting with. Okay. It'll just make things a little bit easier if they're in the network as well. Okay. Questions on that?
Is it safe to assume that all the doctors that service the nursing home are covered under those plans?
No, and that goes for hospitals as well. A lot of people go to the Cleveland Clinic or UH. Just because the doctor is at that hospital doesn't mean that his services are covered by that hospital's contract. So that's why you want to go specifically to your physician's office or your specialist's office to make sure.
Well, my father is in the SEC, so
Okay.
he only sees whatever doctors visit him there.
Okay.
And anything is only done through whatever
Their billing service or whatever, right?
Correct.
Okay.
Is it safe to assume that all of those are within your circle since you're using them, or do we have to get a different doctor to come in and see him because the ones you have on site don't
Actually, I think Lisa has some insight to that.
We are working, right now, our doctors were a little oblivious to all of this.
Yeah.
I'm just gonna kind of throw that out there. They didn't understand how it really impacted them. We've been meeting with them and working with them to try to contract with all three carriers so that there's not gonna be any interruption or discrepancy
It's an
here.
experiment.
So we're actively working with them on that process, the attending physicians
That's why I
and.
was kind of wondering,
Yeah.
if whoever you see at
Mhm.
this facility is
Mhm.
going to accept one of these three or whichever again.
What we can do too is once I get the commitment from each of them and know who exactly they're contracted with, we can organize a list, and we can mail that out to all of you so that you know which doctor's contracted with which program. Okay?
So this facility's gonna be in that place?
We're working with the facility is, yes. We're
What
working
Yeah,
on,
the raccoon.
what counties?
No,
It's
raccoon go across the road.
Well, they roll out at different times, but the first rollout is with us with Geauga, Cuyahoga, Trumbull. Kelly has the list up there.
Yeah, sorry about that. Cuyahoga, Geauga, Lake, Lorraine, and Medina counties were all in the same rollout period and have the same carriers in our counties.
My understanding is we decided to make a decision by March 18th.
That's what the letter is telling people.
Right, I mean, that would seem like a very short window.
It does.
To accomplish all the things that we think we need to do.
It does. It does and it is. And I was shocked actually when I saw the first letter and it said the 18th. I'm like, oh my gosh, that's like 2 weeks away. Actually, the letter reads that if you do get a letter, it will read that as of a certain date, if you don't enroll, we're going to enroll you. Okay?
Yeah.
And they can, and they probably will do that. However, you do have the option by April 30th to change that plan. If you do some research, you find out where your doctors are, you can change it before 5/1.
Kelly, if you opt out of the Medicare portion and remain traditional Medicare, essentially you can still use all the same doctors, specialties, facilities, and you don't have to go through and do that check?
That is correct. That is correct. If you decide to stay with traditional Medicare, your doctors are the ones who bill Medicare B for their services. So if you choose to remain in traditional Medicare, your doctor services will likely not be interrupted.
If we do choose to stay with traditional Medicare, I'm honest that it doesn't jeopardize for staying here at all.
It does not.
So you don't have to change that criteria.
You do not have to, no. And it's my personal, I'm going to say personal opinion, that until, this is all brand new, and all the kinks need to be worked out and things like that, it is my personal opinion that if you keep your Medicare, traditional Medicare benefits, you will and should probably see the least amount of interruptions, because your doctors are already currently enrolled in the Medicare program.
They're familiar with the ballgame.
They're familiar with that ballgame, right. They're not as familiar with this new dually eligible program. Okay.
Let's back up to that thing you said about Anthem.
Oh, yes.
Pensioners.
Yes.
If my mother's here and she was with the Postal Service and has Anthem Blue Shield
Okay.
as her co-insurance, that kicks her out of this. She doesn't change anything.
We would have to look at the type of plan it is. If it's a supplemental plan,
Yes.
then that does not disqualify her from this program. I'll give you a good example of what works. My mom, for example, she works for the state of Ohio. So she has through Humana, through PERS, okay? And that's separate because she paid into her pension while that whole time. She didn't pay into Medicare and Social Security. She paid into her pension.
Well, that's the way Mom.
Oh, okay, then, yeah, we'll definitely probably want to take a look at it. We'll make a phone call and try to dig a little deeper. Now, my mom happens to also work in the private sector, so she actually has both, okay? She has Medicare, traditional Medicare, and she has her PERS. Yes. Because she worked enough quarters to qualify for Medicare, and she also paid in to her pension long enough. So mom's an oddball in that fact, and mom would be the perfect candidate who would not be eligible because she has that PERS pensioners plan.
What you just described.
Is that?
That's exactly.
Again, we'll triple check it, but if that's exactly it, then she may not qualify.
So those people, like, still getting the letters sent to them? Because I'm wondering if that's maybe the reason why you haven't gotten a letter yet.
Okay. I'm smiling, so I'm going to watch what I say here, but yes, I do believe that letters could potentially be sent out in error. So you always want to know what benefits you have and what type of plan you have. And if you're not sure, contact your carrier and ask them, you know, is this a pensioner's plan? Is this part of the dually eligible, or is it separate? And if you're still unsure, Val and I will be happy to make that call for you.
Are you here?
I travel, but I can be here, you know, if Val wants to schedule, maybe we can, you know, I can schedule a few days here and we can have some more meetings or maybe more one-on-one time to discuss individual policies and plans. I'll be happy to do that. I'm going to look for there's something I want to point out to you in your handout. And once I find it, I'll tell you the page.
Except the way you get right, turn the pages right. Can't read it all.
It's page 3, right in the middle. What happens after I choose my MyCare Ohio plan? Okay. Once you choose your plan, you will get an ID card and a benefit book, which makes for very interesting reading. And you'll notice the second line says, after a transition period. That's that demonstration period that we have here. You will have to get health care from doctors and hospitals that are contracted. Okay? So at some point, and they're telling us right now that it's after the 3-year demonstration, but again, it could always change based on, you know, what the legislative rulers decide. But at some point, yes, your doctors, everybody will have to be contracted with the individual plan that you're in. Okay. Right underneath it, if the doctor or hospital does not want to work with your plan, you may have to change. Good news, if you decide to get both Medicare and Medicaid through your one plan, and you decide you're starting to get into it, and you're like, gosh, none of my doctors are in here, I don't like this, you can change your plan monthly. So, yeah. It's not ideal, but what they're telling you is that if you get into a plan where, oh my gosh,
Yeah,
I'm just
it
not...
take a month or 3 months to catch up with the other side going the other way.
You're right, yes, you're right. But you do have the option to change. Again, even after, you always have the option to keep your traditional Medicare. That option is not going away. Okay? You can always keep your traditional Medicare benefit. That's what they're, as of right now. If you are concerned or a little leery, you do like your Medicare benefits, you can still keep those. Okay? It's just for your Medicaid benefits, you're going to end up going through the insurance carrier rather than traditional Medicaid where you get your card in the mail.
And when does that take effect?
For this first round, 5/1. And you do have, they will automatically enroll somebody. If you're eligible, They will and can enroll you automatically, and you can jump in by April 30th and actually change that before 5/1 live date.
I thought you were gonna tell us about each of the three of them. There's three of them. I thought you were gonna tell us about each one. Which
Well-
is the better one.
That was a little bit harder for me. We do currently have a contract with all three, so I am familiar with the plans. But unfortunately, I'm only familiar from a hospital and nursing facility standpoint billing. I'm not as familiar with the physician side.
Since you've got all three plans listed here, will all three of them cover the same here at this institution?
It will, yeah.
Okay, so that part doesn't matter which experiment you decide to choose?
That's correct.
Okay.
That's correct. Now, I can give you my personal opinion, based on like our billing experiences.
That might be good.
I mean, I can certainly do that. But again, I think what's going to be probably more concerning, because we have all those contracts, we get paid the same either way. So, it's not as important to me which one you choose. It's your external services that I want you to be more concerned about.
So the external services would come into play if and when we leave from this facility then?
Or even if you get services while you're here.
Okay,
You know,
or if
you
we
go
get
out-
referred out.
Yeah, if you're referred out, you maybe get some outpatient surgery or something.
All right.
Or you have a specialist, that you go to a lot, or dentist, vision. You gotta think of that stuff. But again, if you keep your traditional Medicare, most of those do bill Medicare first.
Okay.
So,
How are the pharmacies involved?
Yeah, lab tests.
pharmacy, remember, that goes to the Medicare D. You will keep if you have Medicare D, you will be keeping, that's not gonna change.
Even if you have Medicaid?
Yes. Yeah, your co-pays can be billed to this insurance carrier, rather than traditional Medicaid, but you'll still go through the Part D plan to get your script. If you are not on a Part D plan, does somebody, are you referencing somebody that might be Medicare and Medicaid but no Part D? Okay. It's my understanding that if you have Medicare and Medicaid, I'm thinking that you would naturally have Medicare D unless you had pharmacy coverage through your supplemental insurance. For example, Mom has her pharmacy coverage through Humana, so she wouldn't have Part D because her Humana covers it. So if you do, and likely it's those pensioner plans and things of that nature that would have that coverage. If your coverage is like, let's say you got a supplemental plan through like AARP or something, that's strictly supplemental, that will likely not cover the pharmacy. So most of the time, I believe I work with individuals, if they have traditional Medicare, traditional Medicaid, there is usually a Part D plan involved. If not, we can enroll somebody in a Part D plan.
Just that I'm pretty into this stuff.
That's okay, so am I, so.
What actually covers my non-state here? Is it Medicare or Medicaid?
Okay, it's actually a very good question. People often get very confused about this, and the most people that do are like doctors and stuff, oh, Medicare covers everything. Well, it doesn't, okay? So if you have regular Medicare and regular Medicaid, Medicare A covers your hospital stay and room and board under a skilled service. So like if you were in the hospital for a few days and you came here, you might be covered under Medicare A while you're receiving a higher level of care, okay? However, once that level of care drops down and you're not meeting that level of care for Medicare, then you're, hypothetically speaking, Medicaid would be your...
So long-term patients here are Medicaid?
Yes. Yeah, long-term, Medicaid. The shorter term is the Medicare. How about Medicare, just therapy services? Okay. Kathleen's smiling. I'm glad you came. Sometimes somebody can be long-term, and Medicaid will pay their room and board, like our daily rate. Medicaid would pay that. But if something happens and they're not quite at a skilled level of care, but they do need therapy services, those we bill under Medicare B. Okay? So let's say maybe you had a fall or you were ill for a while and you just need a little strengthening. Those services, the facility would bill to Medicare B. Yes.
Medicare can add to Medicare can be permanent.
I'm sorry?
Who's the Medicare? The Medicaid.
Yes.
Medicaid.
It's a good question. Medicare is usually first if you're at a skilled level of care, then Medicaid pays. The only time you would actually come off of Medicaid is if for some reason you no longer qualify for Medicaid. Like let's say you inherited $200,000 or, you sold a house or you won the lottery. Otherwise, you would maintain, as long as you qualify for Medicaid, you can stay on Medicaid. Generally speaking, to be qualified for Medicaid, and I'm really putting it general here, is your assets have to be under $1,500, which isn't a lot, actually. Yeah, it is. But, like again, if you have a house and you sell it, your assets would then be above $1,500. So you'd have to spend down that money, and once you did, then you would become eligible for Medicaid. Yes. I'm sorry? Sometimes, yes. Sometimes. You could be on Medicaid and still own a house. Under a couple of conditions. Number one, if you have a spouse in the community and your spouse is living there, they certainly can stay living there. That's called an exempt asset. But if you are admitted to the facility and you don't have a community spouse, you can keep your house, but you do have to list it for sale. After 13 months, your house does have to be listed for sale. There are a few other loopholes and rules, but I won't go into those awful details right now. But it's there are a lot of it's like reading the tax law when you're looking at the Medicaid rules.
Going back to the MyCare, Kelly, if they don't choose to sign off on the authorization form, should they just call the 1-800 number?
Yes.
In the packet?
Good question. I have been on the website that's listed here, and surprise, surprise, it's not working 100%. And I have had to then call the 800 number to finish my application. And the 800 numbers so far, they have been actually very helpful. Yes.
If you sign off on this thing that says you guys would help choose what plan to go with, what's your criteria?
We wouldn't take the ability for you to choose or your loved one to choose. We wouldn't take that away. But it would just authorize us to make changes should something happen currently or in the future. And some of the criteria would be, number one, if it was covered our services, which of course we will have a contract with all three. Number two, once we know what doctors are enrolling in what plans, that would be another criteria, as well as the pharmacy.
So that actually it would be somewhat beneficial to actually sign on this, because you guys are in a position to know when these changes happen, or what we're looking at.
Yes, yes, that would be one benefit, definitely. But it never, I just want everybody to know that if you sign this, you're not signing away your rights.
I understand, but it gives you the authority to make some changes as needed as you see the plan.
That's correct. That's correct.
How about lab tests? Some labs don't seem to be participating along with their doctor or with this institution. how do we know which ones are cooperating?
Most lab companies will bill, right now, I know that they will bill Medicare B for your services.
Okay.
So whether they're actually contracted with us or not, won't matter, because they'll bill your traditional Medicare B. Of course, if you decided to enroll into Medicare and Medicaid into one plan, we would want to make sure that the lab company that services this building would be contracted with those carriers. And I have to be honest with you guys, not everybody's ahead of the game right now. You know, we're talking to some doctors, we're talking to some of our providers, and they don't have their contract signed right now. So it's very, very new to every provider, in Ohio and these counties. And unfortunately, there's been really limited education about this program. This program was supposed to be actually go live like 2 years ago, and it's been postponed twice because they just, weren't ready.
Try to get them to postpone it again.
I can say personally, yes, I have.
Three-year guinea pigs.
I can say personally, I have voiced my opinion on the unpreparedness of some of the carriers and some of the providers. But I do know that I have started the billing test phase with these carriers. So that does kind of tell me that they are going forward with it. I know.
Who did you recommend?
Of the three, just from a billing standpoint, again, I don't want to dissuade you, okay? And I'm not advising either. Which three are we? I will tell you that as a biller and somebody who bills out services, Buckeye and CareSource are the two carriers that are the most friendly to work with. They're a little bit more lenient on authorization. Like, let's say we didn't get an authorization up front, they will oftentimes retro authorize things for us. UHC tends to be a little bit tighter on their regulations. That's just from my personal experience with them. But it certainly is not to indicate that UHC is not prepared. UHC is a very strong company. But just as a biller, those first two have been really easy for me to work with. And remember, right out of the gate, if a provider of yours is not contracted, the carrier, as long as it's authorized, will still pay for those services during the demonstration project.
You mean experimental?
Demonstration.
Demonstration sounds like a euphemism.
The demonstration is countrywide. There are multiple states in this demonstration.
Kind of like the Pelosi deal. Hurry up and sign up, and we'll let you know what you don't get later.
That might be why we're allowed to switch month to month.
They don't give you the contract to read before they sign it.
Yeah.
I will tell you that I'm actually waiting for our contract to come back. But we will be contracted. I do know that. And we will accept all three. Just to kind of put a lighter note on it, the theory of it is actually very good. When you have one case manager who sees your entire medical record, the idea too is that they capture things that maybe you've forgotten. Hey, it's time for your mammogram, let's schedule that. Or, hey, you haven't gotten your dental services, let's get that in. So theoretically, the idea of this is actually a really good tool for your overall health, because they are coordinating all of your services. So there are going to be some items that actually will be very beneficial to people.
This covers dental as well.
Well, it's going to cover the same things that Medicare and Medicaid would. So, yeah.
It just seems at this point, being that the little amount of information is out there, and if this thing is still in a state of flux, I would have to think that giving you guys this option right now of making a decision at this point would be the smart thing to do, only because you would have the knowledge as it comes to this, as the group, you would know.
It is, that's my opinion as well, because we will be the first ones to know what isn't in there or what's not covered. Most of our vendors will want to work with us and be really communicate with us, hey, you know, we can't get this contract, you know, can you work with us here, you know? So,
I mean, if you find that one of these providers is not doing a good job, I think at that point you would let us know we change the providers because these guys are not playing ball or.
yes, yeah.
I mean, I think that at this point, with the short time frame we have, I think that's the best option, only because we don't have the information in our hands on a daily basis.
Exactly, and it's new, and you know, even after this goes live, we might still see more changes coming, because if doctors start pulling out, or if pharmacies start, you know, lobbying, or, you know, you just never know what's going to happen because it is so new.
And they will.
They have been, and they will continue. So any change, you know, what I'm telling you today, in 3 months, they could pass something that changes that, you know, based on customer satisfaction, patient satisfaction, provider satisfaction, you know. Really the intent is not to destroy, you know, the overall theory is good, but sometimes the rollout can be a little.
I know it's early, but do you have any statistical comparison of these three to share with us which one has been most cooperative or responsive and paying you the best?
That's a good question. Probably not statistically, because these three carriers have really they haven't been around for that long. Again, I think, just my personal opinion, Buckeye and CareSource do appear to be the easiest to work with. I have run into some billing issues with Buckeye. Sometimes their system's not updated, or they can't, you know, the claims get stuck, you know, because they don't recognize a certain code or something. But they've been really good to work with us on it. So, just from my point of view, those two seem to be the easiest to work with. And again, especially with being flexible on the authorizations. You know, they tend to, you know, offer a lot more as far as authorizing services.
That's Buckeye and CareSource.
That's correct. And that's just from my experience. And it's not to say UHC is bad at all. I don't mean to give that impression, but.
I don't understand. What about CareSource?
Just that CareSource, from my personal billing experience, tends to be flexible. Like with authorizations, you know, they seem to work with the providers a lot easier with the providers.
And Buckeye?
I think that both of them are about the same. Yeah. A little bit more flexible than UHC, but again, I'm not dissing UHC either. I'm just giving you my opinion, my experience.
Okay, if you want to opt out and stay on traditional Medicare, do you have to call and tell them that?
Oh, that's an excellent question. The question was, do you have to, if you want to opt out of the Medicare portion and stay traditional, do you have to call and tell them? You do. Sort of. You can enroll by paper, by the website, which is not quite working, or you can call the 800 number. You will not automatically be enrolled in the Medicare portion until 2015. Okay? So this year, if you want the Medicare portion, you have to tell them you want it. Okay? Next year in 2015, they're saying, ha ha ha, we're just going to enroll you. So you would have to physically tell them, I do not want my Medicare under this carrier.
Tell them again?
Yes, because you'll have an open enrollment period. Every year you have an open enrollment period.
Do they advise you of that enrollment period?
Yeah, you'll get enrollment letters, and we'll know. We'll know too, and probably every year we'll have just a meeting during the open enrollment for questions and if you didn't get the letter, just so you're updated on what's going on.
Kelly, I've actually talked to a couple of family members who have called the 800 number, the hotline, and I will advise you that they are a bunch of salespeople. I've heard good things, but more bad things. They're trying to push plans on you. And please keep an open mind when you call that it is your choice. Don't let them make the choice for you.
They are recommending both Medicare and Medicaid to go into one plan. So they might be a little pushy with that. And if you don't want it, you tell them, I do not want that. Okay? They cannot force you to do it.
We're going to streamline it as well. If we're going to pass out the authorization forms, if you would like one, if we can they just write on there, please enroll traditional Medicare or
Sure.
whichever plan, and then we can just do it for the family member.
Yeah, if you have something you want us to do, but you want us to go ahead and do it, feel free to write it on there, that's fine. If you're still unsure, we can, work as we find out some more information, we can change those plans. And ideally, if whatever plan is going to benefit the recipient, okay? Again, our bill is always going to be paid because we're going to contract with all three. So we're also going to consider the external services and which plan is going to be best for you.
Is it appropriate to say that this pilot program that's out there is an attempt to experiment with privatization of the administration of Medicare and Medicaid?
Good question.
There is a thought out there that this is attempting to demonstrate a one-payer system. That is definitely not what I'm saying, though. It's just the rumor that I have heard some people talking about. But again, in theory, it's intended to...
Skeptical about everything. I really am.
I understand, I do. But again, it's still your choice to stay in traditional Medicare. And if you are happy with that, then you can have it.
See, I'm more worried about the coverage of my wife. And even, I wouldn't want her to have to give up Medicaid. I remain on Medicare.
You won't. That won't happen. No. Because although you are spouses and you might share the Medicare benefits or the pensioner's benefits, the spouse that's institutionalized or in a nursing home, that Medicaid is their product only. So the only way it's going to get stripped from them is if for some reason they don't become Medicaid eligible. Okay? There's nothing that you can do in the community that's going to cause that to change unless you win the lottery or,
So if I win the lottery and she's not part of it,
what's that rule in Ohio? 50% always goes to the boy, right? Something like that? Any other questions?
If you're going to have all this opposition, how are you ever going to, call in and get all this taken care of on the 18th? It's just not going to happen.
It's going to be a challenge, certainly, because we do have more than one facility throughout these counties. But again, we're going to have a team of individuals that I'm training to actually help go out to facilities or help facilitate, like let's say that the facility will say, oh my gosh, Dr. XYZ and the pharmacy and the lab are all under this contract. This might be the best option. Then we're going to have a small team of people that will help in that interim to hopefully make it the smoothest transition that we can.
Well, what if you can't get on that 18th? And they just choose a plan?
They will, yes, they will.
But then you can't opt out of the Medicare.
You can. You can change it through April 30th, which is the end of the enrollment period. Yes, you can still do that.
We're going to have a team set up here on the 17th to the authorization forms that you do have signed off on already. I do feel confident with the amount that we have that we should be able to accomplish enrolling everyone within that first day. If not, again, we can always, like Kelly said, switch people out by the 30th.
And then, on top of that, my plan as the accounts receivable manager is to then have a second round of individuals to re-verify which plan everybody's in, to make sure that everybody's in the plan they want or that's best for them, and to make sure that nobody was missed, slipped through the cracks, that, oh my gosh, they didn't get into a plan that was good for them. So the first round will be enrollment, the second round will be verification that you did get into the plan that you wanted. I'm not that, I guess because we have contracts, it's not going to change your benefits, at least here, it's just going to change my bill. It goes here instead of there. You're still going to get the same services, we're still going to get the same reimbursement. So, from that standpoint, I think you're going to be okay.
I was just wondering if you could keep us informed as to these different companies, which ones continue to provide the best cooperation for you and for us and everybody involved, so that if nothing else, we can try to get through on their 10-hour telephone call. You call the 800 number, but it only takes 10 hours to get through.
Yeah. You're better to call late at night or early in the morning?
Yeah, some story along that line. As long as Pelosi's in the office, there's going to be problems.
Let me tell you.
Yeah.
If we haven't gotten a letter yet, are we to stay assisting that we're not going to, or we can get one all the way up and just do it until April 30th?
I do believe the letters did go out. So if you did not get a letter, the first thing you want to do is make sure that you are actually duly eligible. Okay, because remember, it's only the duly eligible individuals that can participate in this. You can go to that website on this page, this part works, and you can look in your county and look yourself up, and it will actually tell you if you are part of that program. You can do that without enrolling.
From whom would we receive this letter? You call?
No, it's going to come from the Ohio Medicaid, Department of Medicaid.
I don't remember receiving anything.
You did receive that, yes? Yes. Now, we might have to look at your plan. You may not qualify if you have a pension plan. So, we would have to look at your individual plan to make sure that you might not be part of that duly eligible. You can contact Val, definitely, she's here all the time. You could contact the Department of Medicaid in your county. You can also go on the website on the
We
secret.
live in Lake, and my wife is in Chihuahua.
It's okay, you can contact any, they can look it up. They can look it up. But you can also look it up on this website. Of course, if you're not interested in going on the website and trying to mess around with it, you can call the 800 number and ask them. They can look it up for you as well. I know.
You don't know if your name's on the list.
Yes, they will be able to know if you are part of the duly eligible
I
program.
think we need to do some serious praying.
See, I'm afraid of federal Obama, we still have to have stuff started. And his plan.
Well, I'll tell you, you know what, I will tell you this, that there are systems set up in case there are certain failures, okay? And that's like if the doctor's contracts can't get loaded or the insurance carriers are too backlogged. Part of this MyCare Ohio is to not interrupt your care, okay? So again, even if it's out of network or something, we'll get that authorization and you can still get that care, okay? Your care is not intended to get interrupted, and I don't think it will, because that would be devastating to the pilot program here. So I do believe there are provisions in place so that your care is not going to be interrupted. Okay. You are not going to be denied care just because it's a new program and all the kinks are not worked out. Okay.
I think if there aren't any other questions or any points you would like to hit, Kelly, can we wrap it up a little?
Absolutely. We're trying to think of ways as a company to maintain open communication. So, as we develop ways to provide communication, we'll just keep probably letters first. Just at least keep it open, and whatever I hear, you guys will hear, so.
With these three different options in connection with Medicare, do they dominate, if you're signed up with them, do they dominate the Medicare
No.
compared to the traditional Medicare?
No.
Okay.
If you do sign up both Medicare and Medicaid under this one program, for this demonstration period, they're going to walk and act and talk just like Medicare and just like Medicaid.
Okay, so in other words, it's just the communications thing between them where they can communicate more effectively?
It's the case manager that's the
Okay.
ideal, that one person's going to be helping manage your entire healthcare, not just a specialist here or a foot doctor here. It's going to be, that's the real theory of it.
Okay. I think I understand.
Understand until, they make another change, and we'll have to work out that detail, but it's going to be a big change for you as well as us. So, as we find out different things, we will at least send out letters, so watch your, if you do get something, it might be a communication, so, and probably maybe a lot more forums like this as we get into it, and we start billing, and your physicians and external services start billing, we might have more information then. I appreciate everybody's attendance and patience, and
All I really care about.
we'll get through it. We'll get through it. Just like everything else, everything's going to change, and we'll get through it. I am prepared. Thank you all very much.
Thank you.